name is Abdullah. Today I'm going to take you through a tour for our WellVision eExam service. All right, so first off, we're going to start with in the pre-screening process here. This is going to be our Optomap machine. Now this is going to be a retinal scan behind the eye. This 360 full view of the retinal that checks on the optic nerve, retina, macula, everything behind the eye. The doctor will be able to view that and share with the patients if there's anything that they need to be concerned about with their eye health. Okay, so for our next instrument here, this is going to be our binoptimeter. This will be able to perform a few tests in here. One of them is going to be the depth perception test, color vision test to check if there's any color deficiencies. Also, what we do is your visual fields. Now what that is, that's your peripheral vision test, just to see how well you see in the periphery there. So this is our autorefractor. This will give the doctor a starting point of what your prescription looks like. It also gives the doctor the curvature of the cornea. So this is really important for contact lens wearers, being able to know that curvature of the cornea, how steep it is. The doctor will be able to choose which kind of contacts work best when you do that test here. And last but not least is our tonometer. Now tonometer will test the pressure inside your eyes. It'll be one puff of air on each eye. Also it checks for glaucoma. Okay, so everything I've shown you is available in both services. What I'm about to show you next is only available in our WellVision eExam service. Here's what we're doing in this portion of the exam. This is called our slit lamp. What we do here is we are performing a 15-second video on the front surface of the eye to show if there's anything going on with the white part of the eye there. So if there's any blood vessels, any blood spots, or anything like that, the doctor likes to see this to make sure that the front surface of the eye is nice and healthy. Also, the pupil reacting to the light. So here what we're going to do, I'm going to go ahead and scan that front surface. There we are. And then we scan that back and forth there on both sides. There it is. As we are performing this test, the doctor is receiving all these test results live in a safe cloud that they're able to review as the patient sees the doctor. They're able to review these exams, all the test results with the patients with one-on-one. Next, what we're going to do is, this is what makes this a unique service. Now, there is no doctor in here that we're going to be meeting with. However, we are going to meet with our licensed refractionist. They're going to come on through the screen here, and they're going to be able to do the better test through our phoropter here. We'll have the patient sitting here, looking right at that chart there right in front, and they look through here to detect their prescription to make sure that we can get them to the best vision of 20/20. And then once we meet with our refractionist, all these test results that we've completed in a pre-screening and the refractionist here will get submitted to the doctor, and then the doctor will meet with us here through our tablet. Okay, so as you saw, we've just completed our WellVision eExam service. Now what makes this such a unique experience, in my opinion, is when the doctor comes on, they're able just to have one-on-one time. So when they're talking to the patient, they're able to share all the test results they've done, all the retinal imaging, talk about the health of the eye of the patient, and just have more of that time one-on-one to talk about the concerns and the questions that patients have. Now, oftentimes, as we see doctors, when they are seen in person, they have to perform somewhat of testing. Now, that takes a little bit of time of that visit. With this, there is no test that have to be performed. Our in-house technician and our remote technician was able to complete all the tests that needed, and for the doctor to just have that one-on-one time with our patients.